Has any one of you been a class president?
Almost, but I wish they. I mean, I hope that they have more time on giving the deadlines up front, or not giving the deadlines like near the actual deadlines, because sometimes in our school that's what they do.
Talking about these challenges and balancing of time, do you feel like the school has a special role in at least helping students to minimize the challenges or the stress that comes with academic expectations? But
So really hard for lecture exams. That's why it's really, yeah, compared to laboratory exams where they actually just asking the questions like identifications. That's really easy.
simply promise and you.
Okay, so now, guys, we will ask them some questions since both of them are also nursing students here at Lyceum. So, how is your academic life so far?
So far, my academic life is doing decently great. I still have a lot of pending works right now because I'm very busy with more stuff at home.
Mm,
Uh,
Well, my academic life for now is, of course, that there are some struggles in our time management. Of course,
mm,
we have responsibilities at home, as
mm-hmm.
usual with our parents. Then, of course, as a son, responsible, and also as a
Yeah.
student in school. So you gotta really have to work between those two things to self-manage yourself in your academics and for yourself, and time for anything else. So that's my academic life for now, balancing time management.
So, talking about these challenges and balancing of time, do you feel like the school has a special role in at least helping students to minimize the challenges or the stress that comes with academic expectations? But
Ooh. Well, does the school has
any
the
special role or things that you suggest they can do to help
Yeah.
students to minimize the challenges?
Well, there's one thing I always thought about that I wish they, I hope that they have more time on giving the deadlines up front, or not giving the deadlines like near the actual deadlines, because sometimes in our school that's what they do, where the deadline is nearly close. Like they give you only 3 days to accomplish this project, rather than giving you weeks or
Mm,
months to accomplish. Like, yeah, I really wish they announced it sooner, so that we are prepared to actually do the activities that we are asked.
mm. How about you?
How
uh,
about you?
Based on my opinion, it's more on their enough effort as well. Because based on what I've observed, after the exams,
Mm,
they'll take a even our instructors take a pause of 2 weeks of
mm,
no lectures and everything, and then the next 2 weeks they'll cram everything, and
mm-hmm.
as well as all of us students will get affected as well
Yeah.
with that,
Yeah.
and until we get to our classes.
Okay. So that's for the like typical class in face to face, right?
Yes.
So how about your experiences in clinical duties? Like, can you share some of your most memorable moments there?
Most memorable.
You go first. You have more
Uh,
experience in the
the,
clinical experience.
the only memorable parts in is more on the
Mm,
pediatric intensive care unit
mm,
where I used to take care of newborns.
mm,
Back then kasi mga kapatid ko,
mm,
ako nag-aalaga sa nila nung bata
mm,
pa sila. Kaya being there feels like I'm so welcome. Alam ko kung anong gagawin ko sa
mm,
loob doon.
mm,
And as well as in the delivery room,
mm,
back in the delivery room, there were a lot of nurses that like to lecture me there. Na,
mm,
nare-relate ako since my parents are also medical.
mm. They're in medical
Yeah.
field.
For me, it is really quite memorable for to have a experience in the hospital, because it is the actual thing that in our future jobs talaga. So for me talaga, I take time. Actually, the clinical duties doesn't stress me at all. I actually get more excited doing clinical experiences, because this is the actual thing that we have to learn rather than reading books. While we can actually do it in an actual hospitals. So the most memorable that I have in the clinical duty was when I was assigned in the ICU, where I have to monitor. Well, not a typical ICU. It was a pediatrics ICU, right?
Okay.
Where we have to take care or monitor the babies who are under what is called under the NGT tubes or something. Yeah, it is quite an experience to see those kinds of patient and learn from it, especially as we always see in textbooks. Like we imagine how this would look like in reality. Well, seeing those really opens the knowledge more to us. So that's the most memorable thing that I always do if I'm going to experience in the clinical duties.
Mm.
So that's wonderful. So has any one of you been a class president?
Almost, but I got nominated once, but I actually never. I asked them not to vote because I cannot bear the responsibility of a president.
Okay, okay.
For him, I think he always tells that he wanted to. I don't know
I
if
never,
he's going to pursue it.
Mhm.
I've never pursued. I
Okay.
wanted to become
He
the
wants
class president before.
but
And yet, no, there's
being responsible for class president really is quite challenging.
Mhm.
Okay.
Yeah, yeah, yeah. Okay.
I more struggle on lecture, but I still manage to try my best. So that's why I give more time on lectures rather than laboratories, because I know that laboratories I can bear with them.
Okay.
I actually answer them quite easily.
They want to your
To
comfort
compare.
zone.
Yeah, it is my comfort zone rather than answering the lecture. Honestly, the lecture is really that difficult sometimes if we don't actually know the quite scenarios, because they twisted the
Yeah.
scenarios sometimes
Yeah,
that
yeah, yeah.
sometimes we couldn't understand even though the answer is quite obvious, but sometimes we can't see the actual keywords of these questions
Yeah.
because it's all twisted, especially those with like SATA questions that's so confusing
Yeah.
sometimes. And what they call what's the elimination, the positive and
Yeah.
a
Positive and
negative
negative
questions,
questions.
those are really hard for lecture exams. That's why it's really, yeah, compared to laboratory exams where they're actually just asking the questions like identifications. That's really easy.
Let me ask you guys this question. How do you guys have how do you guys manage with chismes?
Yeah.
Do you
Oh,
believe there is chismes here?
gossips.
Yeah,
Yeah.
gossips.
Uh, from what I kept hearing from other sections or other students around here, of course there will be gossips around. Of course, what's happening around the
Department.
nursing department. Of course, there's a lot of things that quite happen, especially outside the school or sometimes inside the school as well.
Yeah.
I actually have few classmates that were foreigners since elementary. Coming from other countries as well, there where I actually came across with them being friends, but now not so much because they were way back now. But in case of nursing now, yes, having a foreigner friend or even a relationship is quite interesting, of course, because these are two kinds of what it is like. Some things that we are not used to or we not experience it, but having them makes it experience us on what are their experience. So it's like sharing both knowledges that we know.
Mhm.
So that's what makes it more interesting. Having a foreigner friend or a relationship. That's one of my opinion. That's why it's really interesting to have some. They actually have a great physique.
Yeah, yeah,
Yeah,
yeah, yeah.
with
Yeah.
my six
Yeah.
packs,
Yeah.
my six packs.
Okay, but yeah, before I was like that before, but since I am also now friends with foreigners, specifically Africans, yeah, I learned that even if we have different cultures, it's not a hindrance for us to be friends and to
Yes.
create like a relationship that is very, very genuine.
Correct.
Yeah.
It will never be a barrier.
Yeah, it will
Yes.
never be a barrier.
That's true. It's natural to have biases.
Yeah.
But one of the things that we should never do is we should never allow those biases to become our guiding principles. So let us practice this principle of love for all, hatred for none. And I believe that the more we get to know each other, the more tolerant of each other, the more we build peace and coexist with each other. So that
People like they would say it's better for women to be in nursing field because of the nature of a woman to take care of people. but you guys, you are men, but you're in the nursing field. Like, what made you decide to go in?
I guess I have to respect my elders as a Filipino as well. Respect your elderlies as well. So I took nursing. I give it a try, like as my parents told me.
Mm-hmm.
Of course, there were some struggles
Yeah.
learning it. Well, as I grow with the course itself, I guess it kind of adapt to me as well on how to take care of people. Now I have a passion like putting other people's first before myself.
Mm.
Mm-hmm.
So that's what I adopted the most. Of course, since we all took an oath
Mm-hmm.
on the campaigning that we should take care of other people's before
Yeah.
ourselves. That's the oath we took, and yeah, I kind of adapt to that. So for sometimes now, time to time, I take care of people who are in needs. The more, especially in the hospitals, the more that they needed to talk about what their problems are, on what they needed the most. Yeah,
Mm-hmm.
that's what nursing for me. And as a male, I don't think nursing isn't just for females.
Yeah, yeah,
Yeah,
yeah.
Mm.
because some males has the ability
Mm-hmm.
to take care of others as well, not just for females but also
Mm.
for men who
Yeah.
has the urge or has the the capability and ability to actually take care of other people's or patients as well.
Mm. To sum up, or like before we end this video, I guess I also want to ask you guys, like, what are your advices to students who wants to take nursing?
Guys, my best advice if you want to take nursing, remember is that it takes a lot of patience, like
Yeah.
a lot of patience. You have to read a lot of lectures, slides, textbooks.
Mhm.
You need to have a lot of patience. It's not
Mhm.
that easy.
Yeah. Well, for out there who are planning to take nursing, just remember that nursing is not a career, or it is a calling for us.
Yeah.
So if you feel like nursing is for you, if you feel like taking care of other people is for you, do not be afraid to take nursing at all.
Mhm.
And if you can try as well, don't give up. Maybe you can be a doctor someday, like this guy who's gonna take medicine.
Yes.
Sure, you can do it. Good luck with that.
Mhm. Yeah.
But yeah, never be afraid to take on any step that you are afraid of. Take the next level.
Yeah.
Be, you surprise yourself.
Yeah.
You never stay on that small box that you live in.
Yeah.
Explore more.
Uh-huh.
So
Yeah.
yeah.
And I think nursing, taking up nursing, it will make you, or it will give you so much realizations that you can,
Yes.
at first, this thing, you will feel like, oh, I can't do it. But if you start studying nursing, you will realize, oh, I can do it. It's just what do you call this? You're just doubting yourself. So
Yes.
if you really want to take nursing, then just go for it.
Yeah. So that's it. I really enjoyed this conversation with these guys. I know you guys might also have um, comments
Yeah.
or thoughts on what they have shared so far. If you have any additional things that you want to say, just make sure you drop it down there. Peace out.